Welcome to Dr. Alicia's MedTalks, where we dive deep into medical insights designed to help you take charge of your health. Today, let's explore one of the most crucial yet underrated components of joint health, cartilage. Often overlooked, cartilage is the silent guardian that allows us to move freely without pain, yet many of us don't realize its importance until something goes wrong. If you've ever climbed stairs and felt knee discomfort, heard a cracking sound when getting up, or experienced stiffness after sitting too long, your cartilage might be trying to tell you something. These subtle signs can hint at deeper joint issues that, if ignored, could lead to serious mobility challenges later in life. Cartilage is a specialized, flexible connective tissue that plays a vital role in joint function and body mechanics. Unlike most tissues, cartilage doesn't have its own blood supply, a feature called avascularity, which means it heals much more slowly than muscle or skin. Because of this, even minor damage can take a long time to recover or worsen without proper care. Cartilage exists in multiple forms throughout the body, with three primary types. First is hyaline cartilage, the smooth, glassy kind found on the ends of bones and joints. This type ensures low-friction movement. Then there's fibrocartilage, a denser variety that offers structural support and is located in intervertebral discs and menisci. Lastly, elastic cartilage, which offers greater flexibility, is found in structures like the ear and epiglottis. Functionally, cartilage serves as a shock absorber, providing a cushioning barrier between bones, supporting soft tissues and enabling seamless, pain-free movement. It even plays a key role during fetal development, as the entire embryonic skeleton is initially composed of cartilage before it gradually transforms into bone through a process known as endochondral ossification. Yet not all cartilage turns into bone. Some regions, like the joints, rib tips, nose, and ears, retain cartilage throughout life. As we age, however, this tissue tends to thin out and become brittle, particularly in high-load joints such as the knees. This degeneration often marks the beginning of osteoarthritis, a condition characterized by chronic joint pain and reduced mobility. The knee, in particular, is one of the most intricate and weight-bearing joints in the human body. It connects the femur, thigh bone, to the tibia, shin bone, and incorporates the patella, kneecap. This joint is stabilized and lubricated by several key components: articular cartilage that coats the ends of bones, the menisci, which are C-shaped cushions that distribute weight, the synovial membrane that produces joint lubricating fluid, and a complex network of ligaments and tendons. When any of these components, especially cartilage, become damaged, the bones begin to rub directly against each other, leading to pain, inflammation, and reduced range of motion. Several common factors contribute to cartilage breakdown. Natural aging is a major cause, but lifestyle choices also matter. Obesity places excessive pressure on the joints, accelerating wear and tear. Traumatic injuries, like meniscal tears from sports or accidents, can compromise cartilage integrity. Poor posture misaligns joint structure and causes uneven stress distribution. Repetitive movements from daily tasks or sports can cause microdamage over time, and autoimmune conditions such as rheumatoid arthritis can inflame and erode cartilage. Recognizing symptoms of cartilage damage early can prevent more severe outcomes. These symptoms may include chronic pain in the joints, swelling, tenderness, grinding or clicking sounds when moving, stiffness, instability, and even a feeling of the joint locking or catching. If you suspect your cartilage is compromised, it's essential to seek medical attention. Healthcare providers will typically evaluate your medical history, perform a physical exam, and order diagnostic imaging like X-rays, MRIs, or CT scans to visualize the damage. In certain cases, an arthroscopy, a minimally invasive procedure using a tiny camera, may be used to view the joint from the inside. The good news is that early diagnosis can significantly slow degeneration and improve long-term outcomes. When it comes to treatment, not all cases require surgery. In fact, non-surgical interventions can be highly effective in many situations. These include rest and activity modification to reduce joint stress, physical therapy to strengthen surrounding muscles, and anti-inflammatory medications to manage swelling and pain. Weight loss, even modest, can dramatically reduce stress on the knees. Bracing can provide added stability, and various injections may be recommended. These include corticosteroids for inflammation, hyaluronic acid for lubrication, and platelet-rich plasma, PRP, which uses your own blood components to accelerate healing. In addition, nutritional supplements such as glucosamine, chondroitin, MSM, methylsulfonylmethane, collagen, and turmeric have shown promise in supporting cartilage health. When conservative methods aren't enough, surgical options like microfracture, stimulating cartilage growth, cartilage grafting, stem cell therapy, or even full knee replacement may be considered. These interventions depend on the severity of damage and overall health condition. However, surgery should always be the last resort, and many people can manage their symptoms effectively with lifestyle adjustments. Diet plays an incredibly powerful role in supporting joint and cartilage health. Certain foods are naturally anti-inflammatory and help maintain tissue elasticity and resilience. Bone broth, rich in collagen, supports joint repair. Omega-3 fatty acids from salmon and other fatty fish help reduce inflammation. Leafy greens high in vitamin K, citrus fruits rich in vitamin C, berries packed with antioxidants, and seeds and nuts full of healthy fats all contribute to healthier joints. A sample day of joint-supportive eating might include a breakfast of oatmeal with blueberries and flax seeds, a lunch of grilled salmon on a spinach salad with olive oil, a citrus smoothie with walnuts as a snack, and a dinner of roasted chicken with quinoa and steamed broccoli. Exercise is equally critical. Low-impact cardio like swimming, cycling, and brisk walking can maintain joint mobility without overloading the knees. Targeted strength training such as wall sits, step-ups, and leg raises can help support the cartilage by strengthening the surrounding muscles. Stretching the hamstrings, calves, and hips increases flexibility, while balance exercises like single-leg stances or using a stability ball improve joint coordination and stability. A well-rounded fitness plan should be done 3 to 4 times a week, with proper warm-ups and cool-downs. Always consult your doctor before starting a new routine. It's important to clarify a few common myths about cartilage. One misconception is that once cartilage is gone, it can never regenerate. While full regrowth is unlikely, the body can initiate repair under the right conditions, especially with new regenerative therapies. Another widespread myth is that joint cracking causes arthritis. However, there is no conclusive evidence linking the two. Also, while some people are skeptical about joint supplements, several studies support their efficacy in reducing pain and improving function. Real-life stories show that cartilage care makes a difference. Carla, aged 52, reversed early arthritis symptoms through swimming and weight loss. James, 38, recovered from a torn meniscus using PRP therapy. Maria, 67, found renewed independence after undergoing partial knee replacement. These examples underline that recovery is possible with the right interventions and dedication. Frequently asked questions from the community include, can cartilage be naturally rebuilt? To some extent, yes, through a combination of proper nutrition, exercise, and sometimes supplements. Is running bad for your knees? Not necessarily. Done with good form and supportive footwear, it can be safe. Is surgery always required? No, many people manage symptoms with non-invasive therapies. Joint care isn't a new concept. Historical practices from around the world highlight its importance. Traditional Chinese medicine uses acupuncture, Ayurvedic medicine incorporates herbal remedies, and ancient Greek physicians recommended therapeutic exercises. Today, modern technology is enhancing our ability to prevent and manage cartilage damage. Innovative therapies such as stem cell injections and lab-grown cartilage are being explored. In some hospitals, patients' own cells are cultured and re-injected to stimulate repair. Though still experimental, such treatments hold promise for the future. Wearable tech is also changing the landscape. Devices like smart insoles and knee braces can track joint stress and send alerts if you're placing too much pressure on your knees. This real-time feedback allows for early adjustments in posture or movement habits before permanent damage occurs. Mobile apps now guide users through daily exercises, nutrition tips, and joint-friendly routines. Schools, workplaces, and community centers are also promoting joint health with initiatives like ergonomic furniture, regular stretching breaks, and active commuting programs. Beyond the physical, joint problems often have emotional and psychological consequences. Living with chronic pain can affect mental health, leading to frustration, sadness, and even isolation. Simple pleasures like walking, dancing, or playing with grandchildren may become challenging. This emotional toll must be acknowledged as part of a comprehensive treatment plan. Incorporating stress management techniques such as mindfulness, meditation, or yoga can alleviate some of this burden. Gratitude journaling and daily breathing exercises can also help balance the mind. Equally important is sleep. Poor sleep not only worsens inflammation but also hinders the body's natural healing processes. Building a healthy nighttime routine, limiting screen time before bed, and using ergonomic pillows can enhance rest and improve recovery. Community support, whether in the form of local groups, online forums, or physical therapy classes, can reduce feelings of isolation and provide a sense of belonging. Ultimately, education is empowerment. Understanding your own anatomy, the function of cartilage, and how lifestyle factors influence joint health puts you in the driver's seat. You don't need to be a medical expert to make informed decisions. A little knowledge, consistency, and the right support can go a long way. With care and commitment, your joints and your life can remain vibrant and mobile, no matter your age. So, take the first step today. Get a proper diagnosis, adjust your daily habits, begin strengthening exercises, nourish your body with the right foods, and stay consistent. This journey isn't just about avoiding surgery. It's about reclaiming ease, confidence, and control over your well-being. Thank you for joining Dr. Alicia's MedTalks. Stay curious, stay strong, and above all, stay proactive about your health.